Hello, welcome to Dental Notes and Mnemonics. In today's video, we'll be discussing the differential diagnosis of radio-opaque jaw lesions. These lesions can be tricky to identify, but by understanding the key radiological features, we can narrow down the possibilities. So let's dive into how we can categorize these lesions and what to look for in their radiographic appearance. When looking at the radiopaque jaw lesions, we have to consider the several important points, and three important points are attenuation pattern of the lesion, margin characteristic, and relationship to the adjacent teeth and bone. The attenuation pattern first. Attenuation refers to the reduction in the intensity of the radiation as it passes through a material. In context of radiology and imaging, attenuation describes how different tissues absorb or scatter X-rays, leading to varying degree of brightness on the radiographic image. In case of attenuation pattern, the lesions may be divided into the categories having high, low, and the intermediate attenuation. In high attenuation, tissues that are dense such as bone absorb more X-ray and appear white, that is radiopaque on the image. Examples include the calcified structures and certain other lesions. Tissues that are less dense like hair or fat allow more X-ray to pass through this, appearing darker, that is radiolucent on the image, and they are said to have the low attenuation. And in between these two, some of the tissues are there such as muscle and soft tissue. They provide a moderate level of attenuation, resulting in shades of gray on the radiograph. These lesions are said to have the intermediate attenuation. Basis of attenuation pattern, the radiopaque lesions may be divided into three categories. First is the dense radiopacities, ground glass appearance, and mixed lateral and sclerotic pattern. In dense radiopacities, these areas on the radiograph that appear very white due to their high density. Such lesions result from the structures like unerupted teeth, hard tissue overgrowth, or areas where the bone has become abnormally dense, which is known as osteosclerosis. Ground glass appearance refers to a hazy or frosted glass-like texture on the radiograph, and it is often linked with the irregular or disorganized calcification in the bone. It's seen in cases involving abnormal bone formation or metabolic disturbances. Mixed lytic and sclerotic pattern indicates a combination of radiolucent and radiopaque areas within a lesion, reflecting both bone breakdown, lysis is there, and new bone formation is also there. So this pattern often appears as a lesion matures. Please go through this chart where I have provided a differential diagnosis of radiopaque lesions according to the attenuation pattern. Based on the attenuation pattern, the radiopaque lesions may be further classified into odontogenic and non-odontogenic. Odontogenic lesions usually support a component of a teeth, and non-odontogenic lesions they develop from the osseous origin and are not related to tooth structure. On the basis of the relationship of the teeth in the radiopaque jaw lesions, it may be a pericoronal lesions which is located around the crown of the unerupted tooth. The pericoronal space is often a site of odontogenic lesions, meaning those that arise from the tissue involved in the tooth development. An example of this is an odontoma, which is a benign tumor that forms a dental tissue. Pericoronal lesions can include dentigerous cyst, which forms around the crown of the unerupted tooth and are usually associated with the third molars. We'll also see the relationship of the teeth with respect to the tooth root. Lesions that are situated close to the roots of the teeth often have implications for the periapical health. These lesions may arise due to the infections, inflammations, or other pathological processes affecting the tooth root. Some lesions may have no direct association with the teeth, indicating a more systemic condition or primary bone pathology. These lesions are not influenced by the presence or absence of teeth. The conditions such as fibrous dysplasia or certain benign tumors like osteoma may present as a radiopaque lesion in the jaw but do not correlate with adjacent teeth. Basis of the margin characteristics of the radiopaque lesions, so we may divide them into three categories: those which are having the well defined margins, with poorly defined margins, and having scalloped border. In the well defined margins, these lesions have a clear and smooth boundaries. They are often indicative of benign conditions, and they are less likely to invade the surrounding tissues. The example is odontomas, which are benign tumors associated with tooth development. Lesions with poorly defined or ill-defined margins may suggest a more aggressive behavior. These margins may indicate that the lesion is infiltrating into surrounding tissues, which raises the possibility of malignancies. Conditions such as osteosarcoma, which is a type of bone cancer, and metastatic carcinoma, which is a cancer that spreads from the other part of the body to the jaw, typically exhibits poorly defined margins. Finally, the scalloped border, the lesions that exhibit scalloped or irregular borders are often associated with non-aggressive lesions. These borders may adapt to the shape of the adjacent anatomical structure rather than invade them. A classical example of this is a traumatic bone cyst, which is benign, fluid-filled cavity in the jaw that does not typically show aggressive behavior. On the basis of appearance of characteristic of radiopacity, it may be homogeneous, may show the multilocular radiopacity, or ground glass texture may also be evident in the appearance of the radiopaque lesions. Radiopacity appears as a dense and uniform appearance and typically benign or developmental. Example includes odontoma or sclerotic lesions. Multilocular radiopacities are multi-chambered, often with soap bubble appearance, seen in some benign and aggressive bone lesion, for example, ameloblastoma and aneurysmal bone cyst. And ground glass texture is the appearance of the granular appearance. It is resembling a frosted glass, often associated with metabolic or dysplastic changes like fibrous dysplasia or hyperparathyroidism. Systemic and extragnathic findings are very essential to consider in context of the radiopaque lesion, as they can point towards the systemic diseases or conditions which manifestations in a jaw or bones. Paget's disease may present as a cotton wool radiopaque lesion in bones, including the skull and jaws. Fibrous dysplasia is characterized by the ground glass or the frosted glass appearance in the affected bones, commonly maxilla. Osteopetrosis may appear as a generalized radiopacity due to increased bone density. Hyperparathyroidism can lead to brown tumors causing radiolucencies, but may have the sclerotic changes in some areas as well. Please go through the charts provided here. This will provide you a practical guide to help you to make a differential diagnosis of various radiopaque lesions. So this was all about the hyperdense jaw lesions. Thank you for watching. If you found this video helpful, please give it a thumbs up and subscribe for more insights and hit the bell icon to stay updated on future content. Thank you. Have a nice time. Until next time, keep learning, keep growing, and take care. Thank you. Thanks a lot.